Hello, I'm about to perform tracheostomy care. First, I'm going to review the chart and see when the trach was placed and how long ago the trach was cleaned. And then I'm going to go into the patient's room and let them know about the procedure and what the trach care, what I'm about to do. So first, I'm going to put on my gloves. Well, wash my hands first, then put on my gloves. Then I'm going to remove the old gauze and discard. Then I'm going to go ahead and suction the patient. Make sure that I get any excess out of the inner cannula. Go ahead and open up my Trach Care kit. Go ahead and take my gloves out. Let me go ahead and auscultate and listen to the breath sounds on both sides. Okay, everything sounds good. Go ahead and put on my sterile gloves. I'll go ahead and pull out my trach equipment. Okay, I'm going to pour sterile water in one side of the trach. And then hydrogen peroxide and sterile water mix. Go ahead and place some of my Q-tips in the sterile water and some in the mixture. I'm going to get a piece of gauze, dip it in the hydrogen peroxide sterile water mixture. I'm going to clean around the site. I'm going to get Q-tip that's dipped in the hydrogen peroxide water mix and swipe going away from the stoma and discarding. Get another one. Going away from the stoma site. Then I'm going to use the Q-tips dipped in the sterile water to rinse. Now I can remove the inner cannula. And I'm going to dip it in the hydrogen peroxide sterile water mix. And now I'm going to clean the inner cannula with the brush, making sure that I go through to get anything out of the inner cannula. I'm going to brush the outside. And now I'm going to take the pipe cleaner, clean the inside of the inner cannula with the pipe cleaner. And now I'm going to place the inner cannula into the sterile water. And I'm going to take the other pipe cleaner, go ahead and clean the inside, make sure I have everything out of the inner cannula. I'm going to dry the cannula off with the other gauze. Now I can insert the inner cannula, making sure I hear it click while holding, and it clicks so it's in place. Okay, so now I'm going to go ahead and remove the tie. I'm going to have to cut it. Get a clean, fresh tie. I'm going to make sure it's at least 2 fingers hold. Tightness around the neck. Go ahead and tie that side up. Now I can place the gauze underneath. Making sure that the gauze is placed as flat as possible underneath the tray. Now I'm going to reassess the patient. I'm going to check breath sounds, respiratory rate, heart rate. Make sure that the trach hasn't moved down. And also check the CO2. Just check anything that I think that I need to check to make sure that the trach is in its right position. Everything seems fine. So I'm going to go ahead and remove my gloves. I'll take these gloves off. And wash my hands, and that's the trach care procedure.
Can you identify how frequently the trach needs to be cleaned?
The trach should be cleaned at least once every shift or once a day or PRN whenever it needs to be cleaned.
Okay. Can you describe to me um, three complications that happens with a tracheostomy?
Three complications could be there could be bleeding, infection can occur, and there could be misplacement of the tracheostomy
Okay.
of the trach.
Identify two different systems that allow people with tracheostomies to speak.
The speak easy valve or the passy Mary.
Okay. And can you describe to me how to adapt a manual resuscitator to fit a metal trach?
We would find the appropriate adapter that will connect the metal trach with the manual resuscitator.
Lastly, describe the purpose of a obturator.
The obturator is used to insert the trach, um, and it's rounded at the bottom, so it helps with not scraping the airway versus not having it in. It could scrape the airway and cause bleeding.
All right, thank you.